clinical results. These things are formulated. Does Dr. Stangler and other doctors, they base it off of actually doing real studies, real results? Is there anything more that goes along with that? I mean,
yeah, there are a couple of things that I should mention. One is the clinical results, because these formulas are the exact formulas that Dr. Stangler utilizes in his clinic. We actually make the products in bulk. We put our label on ours, we put his label on his. This is what he sells in his clinic to his patients that he does blood work on. He has a full medical clinic here in Southern California. So these are clinically validated products because he does blood work and he sees the results that he's getting with these products. A couple just quick highlights about the things that make these products different from other our multi, for example. This it's our men's. We have a men's and women's multi. People say, well, what makes it multi different? They're all the same. Well, they're not all the same. First of all, they use additives, but more importantly, there's something called methylfolate. It's folic acid, you would know it as, but most folate is synthetic. The folate we use is actually a coenzymated form, which is sort of a pre-digested form, but instead of costing $100 a kilo, it costs $25,000 a kilo. Now you might ask, yeah, you kind of go, that's what I said.
That's a big difference.
That's what I did when Dr. Stangler said, yeah, I have to have it. And you go, oh, I go, really? And he goes, yeah, I got to have it. Now, of course, you're asking, why is that important? Well, the issue is, it is now known, because of clinical studies that have been done, that almost half the population has a genetic defect. Now, if you have a genetic defect, you can't fix it. You're born with it, you're going to have it for your whole life. And what this gene defect does, it gives your body an inability to be able to properly metabolize folate or folic acid, so that you can't actually get it in the bloodstream in the form that it needs to be in. And then you have to say, well, why is folic acid important, or why is folate important? It's important for brain development, young children. It's important for management of homocysteine, which is heart health. Certainly pregnancy issues with ladies. And I will tell you, this is the only multi I am aware of in the marketplace that uses pure methylfolate. So this is a huge issue and something that consumers aren't aware of, but it's something that we do because we have somebody like Dr. Stangler to formulate our products for us.
So for example, I'm a consumer. I go look at multivitamin. I go to the wherever I'm at. Maybe I'm at Whole Foods.
Right.
Okay, because it's sold there, right?
Yeah.
Yeah. Okay. So
under a different label. But
right.
Yes,
yeah. But okay. But we looking at this product, and I look at another one, maybe like a custom name brand that everyone's heard of. Maybe they have it there. I don't know if they sell it there. I don't think they do. But that product's gonna be a little bit cheaper, maybe, right?
Well, yeah.
But we know why.
Well, exactly.
And that's a huge difference with paying $25,000 for a raw product and paying $1,000.
Well, exactly. I mean, normal folate costs you less than a penny a bottle. Okay. This costs me, I think it's 30 cents a bottle or something. But beyond that, we use coenzymated forms of other vitamins like vitamin B2, vitamin B6, vitamin B12. Other companies don't do that. We use minerals called Albion chelated minerals. Albion's the name of the company. They are the gold standard mineral chelates. And the thing you have to remember is with vitamins and minerals, your body does not produce any minerals, zero minerals. You have to get it out of food supply. Your body only produces a couple of B vitamins, and they're produced in the gut, and most people's guts are so screwed up, your body doesn't, effectively your body produces nothing that's in here. So you have to get it through the food or through supplementing. But now, in the 1950s, we said, oh, we don't need to compost anymore. We can just use synthetic fertilizers, nitrogen, potassium, and oxygen. We can grow plants all day long. The problem is, we consume those plants, and now you're not getting those minerals and vitamins that you need. Plus, we consume foods that destroy vitamins in the body. Caffeine destroys B vitamins. Alcohol destroys B vitamins in the body. Sugar leaches B vitamins out of the body. Stress certainly destroys B vitamins. Smoking leaches vitamin C out of the body, which is why people's skin gets all leathery when they smoke for a long time. So you have to replenish and supplement, but you have to supplement with stuff that your body actually can recognize and that it can utilize. So that's what we give you.
So you don't get the skin from smoking. I thought it was because they're sucking on that little cigarette and they get like it wrinkles. That's not.
Well, that's part of it. I mean, but their whole. I've looked at people who smoke for years, and their skin's leathery. Well, the collagen in your skin, part of collagen comes from vitamin C. Well, if smoking is leaching vitamin C out of your body, guess what? Your body doesn't produce collagen so well anymore, so your skin isn't quite so nice anymore. That
makes total sense.
Right.